We know that it's expensive.
We spend a lot of money.
We know that the outcomes aren't exactly what we want it to be. So some people will say healthcare is broken.
In your opinion, is healthcare broken? And some people have said that equates to healthcare being broken.
Do you think healthcare is broken?
It's broken.
The short answer is no.
To me, the question is, how much better can we get?
I don't fundamentally think the delivery of care is broken.
The actual care is not broken.
I think healthcare is broken in parts.
The business models are.
We found about a third to half of all medical records had an error in them.
I think administrative is 100% broken.
So it's all about standards.
I would say there's nothing broken in healthcare that healthcare can't fix.
In comparison,
We have misaligned incentives.
More importantly, health is broken.
There are a number of ways that the industry needs to improve.
The number 3 and 2 drivers of spend were hospital expenses, followed by administrative expenses.
And be rendered more efficient or better.
Probably everything that is not a provider, a human touch, is broken.
We have to go back and really see what the patients want. We need to drive everything that way.
The real culprit is administration.
on the other hand, there are some people in the U.S. who go to other countries for healthcare because it can be less expensive.
You have a bunch of individual practitioners, but even the individual health systems.
A lot less expensive.
We showed there's still compassion, there's still care, and people really care about taking care of others. That part is not broken.
Then we've got the administrative side, which is just inefficient in so many ways.
Every single person that calls that office, the receptionist answers the phone and immediately says, "Can you please hold?"
But when you overburden these individuals with administrative things, with paperwork,
and that's not their mission, is to be a contact center.
Because they're completely overburdened.
With calls that they have to answer in the middle of things.
We've devalued nurses and what they do.
Their mission is to really cure humans.
That breaks that human interaction as well.
We basically made them front office staff.
One thing that's broken is people walking around today, each and every one of us has slightly different insurance packages and different things are covered.
And of course, lots of people who experience healthcare and compare it to other experiences with institutions that they've had.
Our administrators are dropping the ball.
Removing unnecessary things from humans because that human touch is so important.
Find healthcare lacking.
As you know, the majority of doctors are still fee-for-service.
It's not rocket science.
That's a wrap for today's episode. That's a wrap for today's episode, Naomi.
Yes, if you liked what you saw, please like and subscribe by smacking that like button and subscribe button.
That's fine.